As the world marked International Safe Abortion Day this week, the Seoul City Institute for Social Justice is calling for safe abortions to be widely available, especially in rural areas. Seoul City Institute for Social Justice's Pontsho Pilane joins me now. Thank you so much, and it's always lovely to talk to you and to have you in our atmosphere. I mean, I want to talk about, the availability of access to services. So the right to free, safe and legal abortions cannot be underestimated, but does our country have enough trained professionals to provide the service?
That's a very good question, Iman, because our choice of Termination of Pregnancy Act, the CTOP Act, we have one of the most liberal abortion acts in the world, actually. And however, when we look at implementation, we don't implement what is written, and that is what is a legal right for all South Africans. So there is abortion services in many public health facilities. However, access is impaired by many things. Sometimes, like you're saying, not enough trained health professionals who can perform abortions, but also just the stigma that exists, because health professionals can conscientiously object to performing an abortion, and they exercise that right. But that right comes with a responsibility, which is that if you do not want to perform an abortion on the basis of religion or whatever, you have the right, you have the responsibility to find a colleague who will provide that abortion. But we see the former being exercised, but we don't see the latter, which is really finding a service provider for a patient who wants an abortion.
What happens when people who want to terminate their pregnancies aren't able to do so?
I always say this, and research shows this across the world, that you can never stop abortions. You can only stop safe ones, right? If a person is pregnant and they don't want to be pregnant, they will stop that pregnancy. When access to safe abortion decreases, or when there is no access to safe abortion, unsafe abortions happen. And that has implications on our maternal mortality rate. And South Africa has had a very concerning maternal mortality rate for many years. It also has just an overall impact on a person's sexual and reproductive health and rights.
I mean, it's so interesting, when you talk about people who might want to conscientiously object in providing the service, needing to make sure that somebody else can do it. You talk about the stigma that people typically would report going to centers where this treatment should be available, and a range of other, factors that inhibit the ability of people who need a safe abortion from accessing this. Talk to us a bit more about the split between urban and rural even, which compounds the problem even further.
Definitely, it's easier with many health services. It's not just limited to abortion. It's easy to get it in urban areas because we're closer to better resources. However, when you go into rural areas, at Seoul City Institute, we work in mostly rural municipalities, and one of the biggest issues that we find in those communities is the lack of sexual reproductive health services in general, but abortion specifically. Going back to your initial point around how many trained professionals are there. In rural areas, there's a lot of close-knit communities, and where people are afraid to provide abortions. I've talked to abortion providers in rural Limpopo who say that their colleagues won't even have lunch with them. They're called Satan or Lucifer when they walk in to work, because they are honoring that profession by providing a health service.
So there's a lot of work to do in changing attitudes and creating this awareness around, because it is an access to justice issue, the justice to decide what happens with my body. I want to talk, though, in the alternative scenario where proper, safe health services are unavailable. I know that Seoul City has had, it's like, the whack-a-mole game. You shut something down here, something else pops up elsewhere, getting rid of the pamphlets with these illegal, unsafe abortions. But backdoor abortions are still prolific in South Africa. Talk to us about when women can't access safe and free services, where they go and what happens.
Yes, like you say, if a person wants an abortion, they're going to get it. We, as a country, as a society, have a responsibility to ensure that they get a safe service. When there is no safe service, we see the posters that are littered across urban areas. I mean, I'm from a rural village in Rustenburg, and I saw an abortion sticker on pamphlets and on walls at home, which shows that there's a need. So the reason the unsafe abortion industry flourishes in South Africa is because of the lack of safe services. And so what we see is, yes, we can have campaigns where we march in the streets, we scrub the posters off, but that doesn't stop them. They will be back before the end of the same day. So we need to ensure that we are training enough healthcare workers who can perform abortions. We are really working towards destigmatizing abortion. It is a health service. That's all. The morality, the religiosity that comes with it, it's a health service.
Just listening to you share, you know, what happens when you can't access the services. I mean, already, if you are pregnant and you don't want to have, you know, I don't even want to say baby because it depends on what stage of development that fetus or that embryo might be. There's already a lot of pain, a lot of trauma, a lot of what-ifs, family, and so on. This just adds another layer of stress into, you know, into the whole situation. Talk to us about right now. I mean, if somebody wants to terminate safely, legally, preferably free, what types of services are available for them? So
the best free, safe place is to go to a public health facility, ask and really advocate for your rights. There are many organizations, and even there are many organizations that are tracking where safe abortion services are happening, where cold calls are made to see if this public clinic will give abortions. However, we know Marie Stopes International, which operates in certain urban areas, also provides safe abortion. You always want to make sure that it is an accredited provider. However, and if maybe you go to a clinic, you know, when I've worked with young people who have been turned away from a clinic, you know, one girl was 17 and the nurse told her that she needs her parents' consent. That's not true. So we really need to understand the law, and we need to teach young people what their health rights are, which they don't know. So important, that awareness around what I have the right to do and what I have the right to do autonomously. I have to ask this question. Talk about access to this type of service for children. I'll tell you why. There was a disturbing story we heard recently, you may have heard it too, about child and teen pregnancies really, you know, proliferating in the thousands across South Africa. Some disputes about the numbers, but it's a big number. In Mpumalanga, 9,000 teen pregnancies, 300 between the ages of 10 and 14. Undoubtedly abuse here. How does this call apply to those who are truly vulnerable and their access? So for the past year and a half at Soul City, when the COVID hit, one of our campaigns has been around teen pregnancy. And we actually don't even call it teen pregnancy, we call it statutory rape, because a 10-year-old cannot consent to sex, right? So we have a statutory rape problem. The Department of Basic Education has been busy revising their teenage pregnancy prevention and management policies, right? We want to understand, do those policies have a checklist for either the school or the nurse or the local clinic where a 10-year-old presents as pregnant, that there's an investigation into how they ended up pregnant? Because like you said, more times or less, we will find that it was abuse. A couple of years ago, in collaboration with the HSRC, Soul City did a study on sexual violence in schools. The results show that a lot of sexual violence is happening from teachers in schools or the age mates of these learners, particularly girls. And so when we know what we know about our country and our rates of sexual violence, and on top of that, when we link it to abortion, when we talk about access not just to abortion but to contraceptives, we work with young women, young girls who tell us that I can't go to my local clinic to ask for contraceptives because Nurse Nomsa goes to church with my mother and everyone will know. Or when I get there and I ask for the injection, I'm told that why am I so fast? Why am I this is what's happening. And this is why we work in areas where we call them youth zones, where it's specific hours in a clinic that are youth-friendly services, where a young girl, a 14-year-old, can go into the clinic, ask Nurse Nomsa for contraceptives, and Nurse Nomsa explains all her options for her, and then she chooses the best method for her. So.
Really, we've just touched, the tip of the iceberg only, Pontsho, in terms of this discussion, which leads back to, again, attitudinal adjustments, proper education, and the empowerment of both girls and boys in terms of their rights and responsibilities. Appreciate your insights and your time today. That was the Soul City Institute for Social Justice's Pontsho Pilane.